Hi, I'm Barbara Best,
And I'm Nancy Rizzuto.
and we're both founding partners and principals of CapStrat, and we're also founders of the CapStrat Women's Forum. The core mission of our Women's Forum is to help women succeed in life, personally, professionally, and especially financially.
And we are so passionate about educating, engaging, and empowering women on all aspects of their life. So thanks for being here, and we hope you enjoy the program.
So I sought out our speaker, Caty Stegemann, because of my experience during the pandemic of needing to manage these new aches and pains that I was really struggling with. And it resulted from moving less and working longer hours. Caty is a physical therapist and founder of Center Physical Therapy, and her holistic and attentive approach to patient treatment and passion really for helping others is really what resonated with me, since it's so aligned with our philosophy for client service and also aligned with our values to really help and support the women in our Women's Forum. So Caty, take it away.
Good afternoon, everybody. As you know, just this pandemic has just brought so many of us working from home now. And a lot of us are dealing with so many different things that we weren't dealing with necessarily prior to COVID. So I just want to touch a little bit today on what a good ergonomic workspace should look like. What are different adjustments that we can do to make our workspace more ergonomic? A lot of us have had to deal with doing everything virtually with our children, everything virtually with our work, and we're just not moving as much as we should. So the first thing that I wanted to talk about is having an ergonomic for you workstation at home or even in your office. A lot of times, if some of you are going back to the office now, a lot of times our companies aren't advocates for us to make sure that we have the right chair or with the right desk and everything is the right height for us. And really, if they want to make sure that you are avoiding injury and pain, they should advocate for that for you. But to the side of me here, I have an example of an ergonomic chair. Now, chairs and desks, they can range in prices anywhere from $100 to $5,000, right? So we can definitely find something within your budget that works for you. And if you have any questions, Barbara and Nancy are going to share my email address with you. So feel free to shoot me an email if you have specific questions for you, but we'll talk about that a little bit later too. So you can see with this chair, there's nothing super fancy about it, but what it does have is it has a nice lumbar curvature here. It is also a height adjustable chair, so you can adjust it for your own height. I'm very torso short and long-legged, so I have to make sure that I get a chair that can adjust to a high enough height for me that my desk isn't up here, so that I am in good control of my posture while I'm working at my desk. But not only does the chair need to be ergonomic for you, you have to make sure that you are using the chair properly for yourself. So when we talk about that lumbar stabilization, what you need to be able to do is not sit at the edge of your chair, but get your bottom all the way back so that you can use that curvature to maintain that good, proper alignment. If you're not doing that, what happens is you start to lose your posture in your low back, which then is going to follow up the chain. So you start to lose your posture in your low back, then you start to lose your posture in your upper back, and then you can see what happens to your shoulders. And then when we talk about your neck, your body's main goal, regardless of anything else, is your eyes need to stay on the horizon. That's how we don't trip. That's how we don't fall. That's how we maintain our sense of stability and our sense of balance, and our vestibular system works correctly. So what happens when you're losing that posture, you would think that your head would just follow suit, but your head needs to stay up looking. So I'm exaggerating, of course, but look at the position of my neck now. where if I'm in good posture, I have this much elongation in my neck. If I start to lose my posture, I become very shortened in my cervical musculature. And a lot of you put neck and shoulder and headaches as your main area of pain. And I just want to talk a little bit anatomically about why that's pertinent to posture. So if these muscles become all very shortened back here, all of these muscles not only insert into our shoulder complex, also our shoulder blade complex, kind of how Nancy said that she has that deep-seated mid-scapular shoulder blade pain, but then up into our necks, where Barbara was saying, I have this newfound pain in my neck that I didn't necessarily have prior to the pandemic. A lot of that is from weakness and also from tightness. So really, we should be focusing on taking breaks throughout our day, no matter what, if you have to set a timer to allow yourself to take that break, if you allow yourself to, in a perfect world, take a break every 45 minutes, to take 5 minutes for yourself to do some of the things that we're going to talk about today, that's really a good thing to do. But physically, I think sometimes you have to set a timer for yourself. In the last breakout session, Barbara has this timer that maybe she can show you guys where you rotate it and it goes off, can you set it for 45 minutes so that this timer goes off? If I'm working too long at my desk, I'll simply set a timer on my phone for 45 minutes, knowing, okay, this is time for me to stretch, to do a couple of strengthening exercises for my stability of my upper back and for my core, and to take a drink of water, making sure that we're hydrating throughout our day as well. Because I'm in healthcare, I wear a mask all day. And so me remembering to drink water. Oh, good job, Nancy. Good job. Me remembering to drink water throughout the day is really difficult for me to do. So these are all things that we need to make sure that we are representing the best possible self so that we can portray that best possible self onto our families and our friends and our coworkers. So let's talk about some of the things that you can do at your desk, And I'm going to put together a list of these stretches and exercises and get it off to Barbara so that she can forward these. There'll be photos along with it, so she can forward that on to you. So again, my recommendation would be to stop what you're doing every 45 minutes to an hour and just allow yourself 5 minutes to do these stretches. If you're on a Zoom, take yourself off video and do them and listen to them while you're still, while you're able to do your stretches. So I want everyone to do the stretches with me so that you can get a feel for what it is that we're trying to obtain. So when we talk about the neck tightness, all that forward posture is really shortening all of these posterior cervical muscles. And it's also bringing your shoulders forward. So a lot of times people can start to get pain in the front of their shoulders because they're tight. But then in your upper back, you start to get pain because then those muscles in your back are lengthening. And so muscles don't like to live in a very short position, and they also don't like to live in a very long position. So with posture, we kind of want to live in this perfect balance of all of your muscles living in the length that they are designed to live in. But the typical muscles that get tight, I'm going to show you 3 stretches actually for your cervical musculature, and then we're going to go into 2 just stabilization exercises. So the first stretch, now a lot of us, live like this, correct? So the first stretch, you want to make sure that you are stabilizing through your arm. And there's a few ways you can do it. You can simply outstretch your arm to give it a little bit of traction to keep this shoulder down. You can sit on your hand to keep that shoulder stabilized, or you can simply hold on to your chair to keep that stabilized. But for better view, I'm just going to keep my arm out this way. And then I all want you to grab right above your ear. Don't come behind your head, but go right above your ear. And I want you to simply stretch down. Now, with a stretch like this, we're all going to have a different range of motion. And I see a lot of you look tight to me and a lot of you look less tight. But I want you to think about how much of a stretch you're giving yourself. Give yourself just enough stretch that it's comfortable, you feel it, it's mildly intense but tolerable, and something that you would be able to hold then for 30 seconds. Really, you need to hold a stretch for 20 to 30 seconds in order for that muscle to relax enough that you're actually getting some stretch of the fiber inside the muscle itself. Okay? And then you would do the other side. And my recommendation for these stretches is, again, to hold it for 30 seconds. And then it would be great to do it 3 times on each side. So that's the first stretch. The second stretch is a muscle that comes from the base of your skull and attaches through your neck and then into the top of the shoulder blade. So when we are in this position a lot, again, this is an exaggeration, but maybe not for some people, that muscle gets very tight and it holds your shoulder blade a lot higher than it should be living in space. So that can lead to that upper back pain as well. And just to also point out that all of these muscles insert into the base of your skull. So when you think about this big pull of all these muscles that are inserting into the base of your skull and that very upper part of your neck, headaches are a prime reason as to, this tightness can lead to headaches. So that's one of the prime things that happens with an exorbitant amount of tightness in your cervical spine. So then the second stretch, we're gonna, again, stabilize that arm somehow. And then you're gonna turn your head 45 degrees opposite, hold where your ponytail holder would be, and you're gonna bring your nose down to your armpit. So this stretch, you should feel more posterior along here and then almost to the top of your shoulder blade. Good. Again, you want to hold the stretch for 30 seconds and you want to maintain that good posture while you're doing all of your stretches. Otherwise, you're kind of negating the muscle that you're trying to get to. And then 3 times on each side is a really nice amount of time to be spending doing these stretches. So then on to the next one, we were talking about how those deep cervical extenders, so the muscles in the back of your neck, if you're sitting with this posture, they get very tight. So the best way to stretch along the cervical vertebral column is to do a chin tuck. So when you tuck your chin back, you almost give yourself a double chin, but don't tuck it so you go down. You want to think about your neck going straight back. And then forward again. Good posture while you're doing it. Neck goes straight back. And then forward again. Okay? So that's an appropriate way to do a chin tuck. Now, obviously, you can do those lying down. You can do them standing up. I'm showing you everything in a chair for purpose of you can do this throughout your workday while you're sitting in your chair. Okay, so with those chin tucks, it's really nice to hold those about 5 seconds and do 10 to 15 of those. And that just kind of gets a little bit of fluid flow throughout your cervical spine, where when your muscles are so tight, you're not getting a lot of flow of this lymphatic fluid that you need throughout your cervical spine. That's why sometimes when we're really tight and we do this, our joints pop, because it's this release of this fluid that we have built up within our necks. So if we do these nice sustained stretches and then these chin tucks, that should negate that tightness where we're not getting these popping or cavitations throughout our neck. So now we're going to go into just 2 stabilization exercises that are really nice to be able to do while you're sitting. One of them is to simply activate the muscles between your shoulder blades. But we have to make sure that we're not shrugging our shoulders while we're doing it. And when you do it, I want you to think about not only bringing your shoulder blades together, but also bringing this one back and down as if you're trying to get it into your opposite back pocket. And then this shoulder blade back and down as if you're trying to get it into your opposite back pocket. Our shoulder blades don't work simply in this plane. They work on this plane. It's a diagonal plane that they work on. So when you're bringing your shoulder blades back, you want to think about bringing them back and down just a tad. Okay, holding those for about 5 seconds and then letting it release. And again, doing 10 to 15 of these, hopefully being able to block yourself out every 45 minutes to an hour to just take this time to do it for yourself. Okay, now the next thing I'm going to touch on, it's a very big subject and I could literally talk to you guys for 8 hours on this subject itself, but it's lower core activation. The reason why this is really important is I think that people think of sitting as a passive activity, but sitting is actually an active activity. Your core muscles and your shoulder muscles and your upper back muscles need to all work synergistically to maintain a good posture. And if they're not working, that's when we fall into this slump position, which is probably easier for you to see on the side. You know, we all just get into this position. When I'm like this, first of all that cervical musculature that we just talked about is getting really tight, but I'm not activating my lower core and I'm not activating my scapular shoulder blade stabilizers. Okay, so when we talk about lower core, I'm going to stand up just so I can show you. But if we think about from this hip bone, so that bony protrusion in your hip, to this hip bone, I want you to imagine that there's a string that connects the two hip bones. The string is deep, and I want you to imagine that you are shortening that string. So you're attempting to pull this hip bone closer to this hip bone. Now, a lot of times when you work with different personal trainers or fitness instructors, they will tell you, pull your belly button into your spine, press your spine down into the table. And I teach it very differently because there is a lot of research. This isn't just my opinion. There's a lot of research that involves EMG studies on the proper way to activate this muscle. And this muscle is called your transverse abdominis. So you don't want to pull your belly button up into your spine. That's just creating intra-abdominal pressure. So it's not really activating any sort of muscle. And if you try to flatten your back into the table, that's activating a lot of other muscles as opposed to the one that we're actually trying to activate. So when you pull that string together, it's almost a corseting effect of that muscle, but you're maintaining your spine. So I'm not tucking under, I'm not sucking in, I'm not doing any of that. I'm maintaining a neutral spine while I activate that string muscle, which is also your transverse abdominis. You might feel a little transference into your pelvic floor, and your transverse abdominis, the string muscle that we just talked about, and your pelvic floor are both super important to your core stability and your core strength. They also share a fascial connection and a neurotransmitter connection. So when you're appropriately activating that transverse abdominis, you should feel a little bit of activation of your pelvic floor and vice versa, if that makes sense. So those are really the 5 things that I'm going to put in a list that you can maybe pin next to your desk, maybe laminate it, maybe make copies, you know, have it all over so that you remember to take care of your core health and your stabilization health and your stretching health while we're all sitting way too much. You know, the biggest thing now is sitting is the new smoking. I don't know if it's necessarily that bad, but it can lead to a host of problems. So now I want to talk just a minute. Oh, Nancy.
Yeah, I was just going to ask, something that you mentioned this morning that resonated with me, Caty, was the importance of being sure you're not holding your breath. I do that all the time, whether I'm working out or doing yoga or something, and I realize I'm turning blue and that I'm not breathing. And I think that, can help release some of that tension as well. I do that all the time.
So it's funny, I'm going to talk about breathing next.
Oh.
Yeah, and when you hold your breath, it actually puts a lot of pressure on your heart. So if you find yourself not breathing, and that is part of stress as well, right? I think a lot of times when we're stressed or we're anxious or we're feeling panicky, we find that we're not breathing and our heart rate is going up and our blood pressure might be rising a little bit. And this is all because that inappropriate breath or that non-breathing, a lot of pressure on our heart. If you want to look into it, the technical term for it is called Valsalva. And so by holding that breath, it's so much, interchest pressure that we want to make sure that we are getting rid of that. So that brings me to healthy breathing and unhealthy breathing. So when we talk about breathing healthy, we really want to utilize our diaphragm to breathe. When we talk about breathing unhealthy, there's people, it's called scalene breathing, and you're actually using your neck muscles to breathe. So you'll see people breathing and it's like, you're getting considerably less oxygenation when you're breathing that way versus when you're breathing through your diaphragm. So I'm going to teach everyone just a little diaphragmatic breathing technique while we're all sitting here right now. So I want you to all get in that good posture. You're going to take both your hands and put them just under your bra line on your belly. When you take a deep breath in, and I'm just going to demonstrate first and then you guys can practice it. When you take a deep breath in, what should happen is that your hands should raise. So, okay. Can you see my hands raising? They're kind of the same color as before, but that's appropriately using my diaphragm. So I want you guys to all just sit with really good posture, make sure that you're comfortable, put your hands on your diaphragm and just take close your eyes and just take 3 nice diaphragm breaths where you're breathing in for 2 and out for 2. And then in for 2 and out for 2. And then in for 2 and out for 2. So I recommend, this is one of those, your diaphragm is a very learned muscle. Once you start teaching yourself how to breathe through your diaphragm, it catches on. It's a pretty smart muscle. So it catches on, and then you start to become more used to breathing through your diaphragm, and it becomes more automatic for you to breathe through your diaphragm. But I think that, with life and with everything happening in life, if we can all just stop, literally, if we have to tell someone, I need you to stop for 1 minute. And then you just allow yourself to breathe. And it doesn't need to be a big show. You don't have to sit and adjust your posture and put your hands here, but just allow yourself to take a couple breaths. It's so healthy for us to get that good oxygen saturation to our brain, to bring our heart rates down a little bit, to bring our stress levels down a little bit, to bring your blood pressure down a little bit. And, it's kind of, I don't know how many of you have little kids, but Daniel Tiger always says, stop and count to 5 before you react to something. It's just this PBS cartoon, but it's kind of like before you feel like your head is going to blow off the top of your shoulders, stop, do a little bit of diaphragmatic breathing, and then allow yourself to react to the situation. And it can really help with your stress levels. And I know that Barbara had mentioned that you guys did one on meditation. I've really allowed myself to learn how to meditate in the last couple of years. And it's so hard to get and it's so hard to grasp, but it's so important. And they really focus on a lot of diaphragm breathing when you're meditating. And, even when you do a meditation, put your hands on your diaphragm, allow yourself to feel that movement. It's very calming to just feel that breath coming in and out of your diaphragm versus, that like stressful breathing. So the last thing that I wanted to touch on really quickly, Nancy, did you have something?
No.
Okay. Is when is this pain that we're feeling normal? And when is it time for us to maybe talk to somebody about it and get some intervention? So the best way for me to describe pain is if you have an acute bout of pain, meaning that you woke up this morning and you had a really stiff neck, the chance of that going away with the things that I just showed you and, maybe putting some heat on it or ice on it and, taking an Advil, the chance of that going away is pretty great. But if we're dealing with something that seemingly is becoming more chronic, then that's when our central nervous system starts to process this pain differently. So it's kind of like the person who gets stuck with a needle one time and they're like, ooh, that kind of hurt. But then the person who gets stuck repeatedly with a needle and repeatedly with a needle, by the 100th time you get stuck with that needle, your central nervous system is processing it as being more painful. Just like when you're dealing with issues that, can start out with a muscle strain or start out with a postural abnormality that you didn't correct right away. And then it just starts to kind of have that domino effect because then, your neck is hurting a little bit because it's tight, but then you're sitting in this posture and then it starts to travel kind of down your shoulder blade. And then you're like, ooh, I'm having a little bit of radiating pain down my arm now. And then, now my low back is starting to hurt. And that shouldn't have gotten that far, right? So maybe prior to it becoming like a 5-stage painful thing, it's probably a good idea to, talk to a trusted health advisor. And Nancy, I forgot to mention this this morning, but you had said that, getting a massage and getting in those trigger points really helps. And it absolutely does, unless it's something that is seemingly more chronic, because you are taking that soft tissue, you're mobilizing it, you're getting that soft tissue to become more healthy, but then you kind of just leave it.
Right.
So as a physical therapist and someone who's been doing it longer than I care to mention, we tend to get down to the crux of why did this start in the first place? What limitations do you have, not only from a soft tissue standpoint, but from a joint standpoint? Are we having some rib limitations now? Are we having some shoulder limitations that require some joint mobilizations? What exercises can we give you to really focus on where we find your strength deficits? Yeah. So I do a lot of hands-on with my patients. I generally tend to spend 30 to 45 minutes of soft tissue, joint work, passive stretching, and all of that. But then you really have to give them the tools as to what they need to take home and what strengthening that they have to do, because we're trying to mitigate the problem so that it isn't coming back and not just trying to put a Band-Aid on a bullet wound. So, there's an end game, I guess I would say in my profession.
So weekly massages are not the answer. You have to get to the root of the problem.
I'm saying weekly massages are a wonderful, fabulous thing. And if you can do it, definitely do it. But that's, I think massages are so great for just overall relax. Taking that time for yourself, which we don't do enough, especially as women. I think that it's great blood flow to the area. It gets your lymphatic system, flowing the way that it needs to. You're able to stretch more effectively afterward. But if there's something that is seemingly becoming a bit more chronic, or you you can't really find the root of the evil, then that's when I would reach out.